Hi, my name is Carol Bell. Welcome to this episode of Strategic Solutions TV. We're so glad you've joined us today. We will be discussing today a really important topic that more and more people are really looking for information about, and that is how do you find a good holistic dentist, especially when you are looking for one online. And today we have a special guest that's going to help us with this topic, Dr. Michael Rouff from Thoroughfare, New Jersey. Dr. Rouff, welcome to the program today. How are you?
Thank you, Carol. It's great to be with you. Thank you.
You're welcome. Dr. Rouff, we know that more and more people are becoming interested in taking a holistic approach to the care of their mouth, and so they're looking for a good biological or a good holistic dentist. And usually they start their search online, and they don't always know what things they should be looking for. So as an expert in this industry, what advice would you give people today as to the kinds of things someone should be looking for when they're looking for a good holistic dentist?
Well, Carol, it's very important to understand that most dentists and even most medical doctors are not looking on how the mouth interacts and affects the rest of the body and the immune system. So I came up with a couple questions that they need to either, if they're calling, they can just ask on the phone, or if they're online, they should be looking for. First of all, the first question is whether or not the dentist places mercury silver amalgam fillings. And if the answer is yes, you've heard enough and you can basically move on. Secondly, if you can ask, does the doctor take any precautions to protect you and his staff and himself while removing the mercury silver fillings? Because there's a lot of mercury that is vaporized and everyone is exposed to, and if they don't take any precautions, then they don't understand the toxicity of mercury, and you can move on as well. The next one would be, do they believe fluoride is a toxin and should be removed from the water, as well as they should not be used in toothpaste and in dental offices, period. Again, that's a telltale sign that they don't understand how toxins affect the rest of our body. The next one is what their understanding is of root canal filled teeth, that whether or not they understand the toxicity of how that affects the rest of the body and the immune system. Another issue is whether they understand the effect of galvanism, which is when you have metal in your mouth, it produces electricity, which affects the energy flow within your body. And then the last one that I wanted to know is whether they have the use of ozone technology to kill microorganisms and to stimulate the immune system at their practice. So those are some good things. Another interesting thing is also if they are a member of one of the groups that I am, which is the IAOMT, which is the International Academy of Oral Medicine and Toxicology, which has been fighting to get mercury banned, fighting to get fluoride removed and banned, and trying to disseminate all this information about the big 5 things which I just kind of really mentioned: fluoride, mercury, root canals, hidden jaw infections, which are a little bit more complicated, which are called cavitations, and metal in general in the mouth and in the body. So those are the basics of the 5 things that I'm trying to kind of bring to light so that people don't have toxic issues that are affecting their immune system and their whole health.
That is such good information to know. I wasn't even aware of a lot of those, and so I'm really happy that you've brought that information out, and I know a lot of people as well, this may be new to them, and so they now have a much better idea of the kinds of things they should be asking when they're looking for a really good dentist. So Dr. Rouff, can you tell us what makes your practice unique, whether it's from the holistic standpoint or just being unique from the other dentists that are in your area?
Well, there's a couple different things. Again, I mentioned the ozone. I've been using ozone in my practice for 5 years. I've been studying it for the last 10 to 15 years. Ozone has been used for over 100 years to sterilize and to purify water. Some people have ozonated pools. It kills all microorganisms, bacteria, fungus, viruses, parasites on contact. It stimulates our immune system. It stimulates our blood supply to the area, and just with no toxicity. You know, again, a lot of times when people are doing root canals, they use basically a form of Clorox, basically to clean inside instead of, and there's some serious toxicity issues with a lot of things. But ozone there is no toxicity, and it kills all microorganisms. We're talking all viruses. We're talking MRSA. We're talking all these other things, and it's a shame that medicine hasn't adapted and used ozone in many other ways as well. It's kind of disappointing. Another thing in my practice is that it's just me. I'm the only dentist. I have one hygienist. We kind of, turns out we really adopt our patients as family. Again, I have a lot of people coming from places that have kind of these mall places, and they kind of feel like a number, and you're definitely not a number. My staff has been with me for a long time, and we take things very seriously, but we get to laugh, and we joke with each other all the time, and we have people actually almost enjoy coming to the dentist, which I know it's hard to believe, but we actually do have a good time while we're there. Another technology that I've adapted in the last 2 years is called air abrasion, where we actually take pieces of sand at a high velocity and blow it at the tooth instead of using the drill, so that it is much kinder to the tooth, more conservative, and then we bond and seal it, and there's minimal fracture potential. Whenever you take a drill to a tooth, the outside of the tooth, the enamel, is very glass-like or porcelain-like. And it's kind of like you take a microscopic slide and you try to take a little teeny drill bit and you try to make a little hole in it. You can imagine there's going to be cracks all over that. With the air abrasion, you can actually make a serious little tiny hole right through it without cracks. So for the smaller fillings, especially with kids, and a lot of times you don't even need to be anesthetized. You can just, if it's shallow, you can blow it out, clean it up, bond it. We also ozonate every tooth before we fill it to kill any microorganisms, neutralize any acid, and help the remineralization, stimulate the nerve, and kill any bacteria that's in the nerve, and then we restore it with a bonded restoration. It can't get any better. I haven't seen anything that can do better than that. And again, I also work with some homeopathics to help people maybe get off some drugs that I'm not a big fan of, like the statin drugs. Again, I help people get on some natural supplements like vitamin D, vitamin K2, iodine, all these natural things to help their immune system and help their body work better, and try to minimize the amount of pharmaceutical drugs which have their side effects and limitations.
It sounds like a much, much healthier way to have any kind of dental work done. It sounds pretty amazing. You're a naturopathic doctor as well, right?
Right, yeah. I went through a 1.5 year long program designed for dentists that then allowed us to learn enough to become board-certified naturopathic physicians, so that I incorporate that into my practice. When someone comes and says, I've been to 5 doctors, they don't know what's going on, then I can at least try to do some research. And I have a bunch of mentors. I have doctors all over the country that I know, MDs who have now gone alternative, who are unbelievably gifted, and the reason why they changed is because they were doing what every normal doctor does. They give people drugs, they do the tests, and they don't look at the root cause. Well, why is this person's blood pressure so high? Or why is this cholesterol so high? Or why are they fatigued? They just treat symptoms. And I call it disease management instead of health care. And these doctors said, this isn't working for me. I need to go look at why my patients are not getting better and why they're staying sick.
Mhm.
And there's a group, there's groups of them all over the country that they have to sometimes be a little careful because sometimes the medical boards and the FDA don't like some of the things that they're doing. And again, in my opinion, there should be, again, if it's they're trying to protect the public from quacks and people who don't know what they're doing. What they're protecting the public from is good medicine, in my opinion.
Yeah, I understand that. Dr. Ruff, you have a special offer that you give new patients, I believe. So could you tell us about that?
Yes, again, I love to be able to meet people and get them in for a half an hour. If you have x-rays, bring them with you. This is basically a half hour of my time where we sit down, review your medical history. I go through with my intraoral camera, which is up on a 32-inch monitor, and we go through tooth by tooth by tooth, figuring out what's going on, what's good, what's bad, and what the possible treatments could be. And that gives you an idea of where I'm coming from and whether we're a good match, whether it's something that you want to proceed with. So it kind of takes the risk off of you, the patient, from coming in and having to invest anything. If you don't like what you hear, then you keep searching. If you like what you hear, then we schedule you for either if you have a problem, we get your problem handled or emergency handled. If you don't have an issue or a problem, then we can get you with my hygienist to do a full initial intake and then start on getting a treatment plan and a priority plan together for you to figure out where we go from there. I always like to kind of work on this 5-question situation. It's like, where have you been? Where are you now? Where do you want to be? How are we going to get there? And what kind of support you're going to need. And once we get those questions answered, then we have a clear path and a clear objective to start our journey. And for me, how quickly you get there is up to you. It's up to your budget. It's up to what your priority is. I always joke, a lot of times I joke with my patients, I have a lot of patients on the 8th year of a 5-year plan. It's okay. As long as you're living your life pain-free, functioning, smiling, doing what you do, that's great. And again, my goal for every patient is to be able to look you in the eye at some point and say, you're as strong and as healthy and as maintenance-free as possible. We'll see you in your next 6 months, and we'll double-check everything and clean you up, and hopefully we won't have to do anything for an extreme long period of time.
That's a great offer. So for any of you who are looking for a good dentist, a good holistic dentist, go in and take Dr. Rouff up on his wonderful offer, free consultation, get a nice video tour of everything that's going on in your mouth so you can really see for yourself what's happening and what may need to be done. Dr. Rouff, what's the best way for people to get in touch with you if they'd like to come and see you?
Well, again, my phone number is 856-845-4390, and also my website is drmichaelrouff.com. We're on Facebook, we're on Twitter, and again, you can always, I'm on the IAOMT website. Again, that's the International Academy of Oral Medicine and Toxicology. They have a lot of good information, good videos and science to back up all the things that we've talked about today. And yeah, and again, the email is drrouff@gmail.com. That's my direct email.
Good. Well, thank you so much. This has been a very interesting, a very enlightening interview and information that you've given us today. I know there are people that are ready to come in and maybe come and see you and have the tour of your mouth. And I know that a lot of people come and see you from all over the country as well. So it doesn't really matter where you may be located who are watching this. Dr. Rouff will see you no matter where you might live.
Exactly.
Thank you so much for taking the time to share this with us today and for being here. We appreciate it.
Thank you, Carol. Thank you for having me.
Thanks for being here today, everyone. Have a great day, and we will see you next time.